Hello my friends, welcome back to my channel, and if you're new, my name is Olaoluwa Fajimi. I'm a portfolio GP and training program director based in Coventry. One thing that causes a lot of my trainee friends anxiety is ARCP. Whether my friends are getting across to me saying they've had a non-standard outcome in their ARCP, or whether they are getting across to me really worried about what will happen during their ARCP, people are worried about it. In addition to that, I've received a lot of your feedback asking me to talk about ARCP. Consequently, in response to your request, I've decided to do a masterclass on everything ARCP. This first video is going to be the introduction to ARCP, but please look forward to the top reasons why trainees fail ARCP and how to navigate your ARCP with ease. If you're yet to see my video on the top mistakes I made in GP training, please make sure to do so through this link. Let's get straight into it. So what is ARCP? ARCP stands for Annual Review of Competency Progression. It is the means by which the postgraduate doctor in training are reviewed each year to ensure that they are offering safe, quality patient care and to assess their progression against standards as set in their training curriculum. Why do we do the ARCP? When you're allowing a doctor to move to the next step in their career, you want to be sure and certain that they've got the skills, knowledge, and competency to fulfill the duties of that next position. You want to be sure they are safe, and you want to be sure they are developing at the rate that will allow them to complete their training. It is for this reason that the ARCP is done. Who does the ARCP? The ARCP is organized by NHS England, formerly known as Health Education England. And how is the ARCP done? The ARCP before COVID used to be done physically. In my region in the West Midlands, it used to be done at the West Albion Bromwich Stadium, where once in a year, all the trainees gather to have their ARCP done. Since COVID hit, it's now done virtually. The ARCP panel is made up of at least 2 or 3 training program directors, with one of them being the chair of the panel. Sometimes there are external lay members who are present in panel just observing. Sometimes you may have educational supervisors who are interested in seeing how the ARCP panel goes, and so they are also present observing the ARCP panel. What does the panel do? What the panel does is to sit down and consider all your evidences against the standard as set out in your curriculum and make a decision as to what outcome are we awarding this postgraduate doctor in training. Now, what are the outcomes? Outcome number 1 is what we call the standard outcome. It is the satisfactory outcome. It means the doctor is making satisfactory progress. They are achieving progress and development of competencies at the expected rate. Outcome number 2 is that the development of specific competencies are required, but the doctor in training does not need additional training time to do so. Outcome number 3 is that there is inadequate progress, and as such, additional training time is required. Outcome number 4 is that the doctor is released from training And the top reason for outcome number 4 is that the doctor has fully exhausted the time required for training, or they are fully exhausted the time and the number of attempts they are or they've got to attempt college exams. Outcome number 5 is that there is incomplete evidence presented. Outcome number 6, which is the outcome awarded at the end of your training, is that you've gained all required competencies and such that the panel is then recommending you for the award of certificates of completion of training, CCT. Lastly, outcome number 8 is the outcome that is given if you're spending time out of program, if someone is taking a year-long career break, for instance, or you're on sick leave, or you're on maternity leave, then the panel will award outcome number 8. One question I've been asked regularly is, Ola, I've been told I've got an early ARCP. What does that mean? Now, ARCP is an annual event. However, an early ARCP is done before the usual time, usually at the mark of 6 months. And the reason for early ARCP is because your clinical supervisor's review has picked up significant concerns, and so they felt there was need to escalate this early such that you get help as early as possible. See your early ARCP as your ordinary, trying to make sure that things are escalated early so that you get an early help to make sure that you finish your training. So after the panel, what then happens? Usually the panel constitutes what we call your ARCP report. And in your ARCP report, you've got your outcome in there and you've got recommendations made by the panel. The most important thing about the ARCP panel is going through the ARCP panel for the recommendation, making sure that you carefully do everything the panel has recommended against the next panel. One of the things panel member will look at is what your outcome was in your last ARCP and what recommendations were made. When recommendations have been made by the previous panel and the panel right now cannot see evidence of those recommendations being put into practice or those recommendations being actioned, then that is a reason why the panel may be considering a non-standard outcome. Now, what does standard outcome mean? A standard outcome is a routine outcome. It means that the candidate is going in the direction we want them to go. So for a postgraduate doctor in training, outcome 1 will be standard outcome. For a doctor in ST3 who is CCTing, outcome number 6 will be standard outcome. Non-standard outcome constitute every other thing outside of these 2 outcomes. Guys, thank you so much for being part of this video. And as I mentioned earlier, there is the top reasons why trainees fail ARCP and top tips on getting you through your ARCP with ease. Please look forward to this video. If you haven't subscribed, please make sure to do so. Our analytics has shown that less than 30% of my viewers are actually subscribed. If you subscribe, it will make sure more and more people see it and more people get the help they so much need. Thank you so much, and I see you in the next video.